and welcome to Midlife Moments with Dr G. I'm Dr Georgina Hale, Specialist Medical Doctor and PhD in Midlife Women's Hormones. And tonight I'm in Marina del Rey, beautiful scene in the marina here, and I want to talk to you about progesterone. So progesterone, remember, is the hormone that is produced in the second half of the cycle. See the graph here. So we've talked about estrogen, that's the one in the black, and progesterone is in the pink. So it doesn't go up or down during the first part of the cycle, it goes up and then down for the second half of the cycle. So it is the hormone that dominates the luteal phase, and luteal phase means luteinization, which means preparation for a pregnancy. So the reason we have a peak in in progesterone, and the reason it comes down again is because there wasn't a pregnancy. Now, if you're lucky enough to get pregnant, your progesterone will rise, and then it'll keep rising as it's going to be supporting a new pregnancy. So the fall in progesterone, when pregnancy doesn't occur, and the fall in estrogen together, but particularly the fall in progesterone, is the key factor that precipitates the bleeding process in the menstrual bleed. Okay, so why would you measure progesterone? Well, really, measuring progesterone is, in midlife and perimenopause, is about measuring whether or not you are ovulating. And as you can see from the graph, you want to measure sort of somewhere in the mid-cycle, in the mid-luteal phase peak of progesterone, and that's going to be somewhere between day 18 and 23. If you're a 5-day cycle, measure around day 18. If you're a 29 or 30-day cycle, you can measure it around 21 to 22, day 21 to 22. So it's giving you the answer of, are you ovulating, yes or no? Now, do we use progesterone levels to find out whether you're producing enough progesterone in an ovulatory cycle? This is a specialty area for fertility studies, but in general for health of hormones and balancing the hormones, I can't really recommend that we do progesterone levels to see whether you're optimal or not. The main reason is, and I've talked about this with estrogen as well, is that the factor that's most important in the level of progesterone that you get from your blood test is where you have the blood test taken, not are you producing enough progesterone. And I think this understanding is not clear even for some doctors, because they aren't aware that even if you have a low progesterone, it could be because you either took the sample on its way up or definitely on its way down. So it's not a good test to tell me whether or not you've got suboptimal or optimal levels of progesterone for your hormonal health. How, for midlife women in perimenopause who are still cycling, how I tend to sort of determine whether there's enough progesterone in terms of body health, for example, it's symptoms. And so when there is highly variable menstrual flow from cycle to cycle, that tends to suggest that you haven't got a good consistent level of the progesterone that you used to have. There may be increased cramping, menstrual cramping, certainly blood clots can occur with lower than your usual progesterone, and I find one of the most common symptoms is a worsening of PMS, premenstrual tension or premenstrual symptoms. That to me is the most common one, in addition to irritability, mood changes. Some women get a lot more bloating, a lot more fingers swelling, and feet and ankle swelling. And finally, there might be some immune changes like skin itching. I find that is often due to sort of suboptimal levels of progesterone. And what might be a suboptimal level of progesterone between women, one can't tell. So it's hard to tell from blood levels of progesterone. It's more likely to be told from your symptoms. And I go through these symptoms in sections 1, 2 and 3 in my new book, and I outline some of the therapeutic options for suboptimal progesterone levels or low progesterone symptoms. And this is where I use luteal phase progesterone support. I find whenever there's a worsening of PMS or mood or irritability and even the swelling, I find the progesterone cream even more effective than just the tablets. The tablets are far better than anything else for optimizing your sleep. So progesterone symptoms, low progesterone symptoms, are really worth looking out for in midlife and early perimenopause particularly, and late perimenopause. When we're in menopause, we don't have any cycling estrogen and certainly no cycling progesterone. There's probably just sort of residual levels of estrogen, and your progesterone gradually sort of almost disappears. So there's a different kind of balance that you're looking for once your menstrual cycles have finished. And during the midlife and perimenopause, it's more, you're still cycling, and it's more sort of a temporary thing where, you know, we can treat low progesterone symptoms. So I hope that was helpful, and I look forward to bringing you more information on midlife and perimenopause and menopause next time.